GLP-1 medications and multiple sclerosis. What does the research say? But the research that's only been done on humans. I'm going to tell you. I'm Jessica Brown. I'm a clinical nutritionist, author of Beyond the Shot. Remember, this is just research and education. It's not medical advice. So first, a 2025 study in multiple sclerosis and related disorders. It followed 79 people with MS on GLP-1 agonists, mostly for weight loss. They tracked body mass index, the expanded disability status scale, a 25-foot walk, and vitamin D, all before and after treatment. Those 79 patients lost significant weight, but disability scores, walking speed, relapses, and serious side effects did not worsen, suggesting GLPs are metabolically helpful and neurologically stable in that clinic. Second, a major MS meeting in 2024, a team presented data on 33 people with MS and obesity, later covered by endocrinology advisor and MS advocacy groups. Most were women with relapsing remitting MS and an average BMI of around 40, and they lost on average about 12 pounds with the typical GI side effects like nausea. But crucially, there were no clinical relapses and only 2 people with new MRI lesions and 1 person who stopped due to side effects. That led the authors to say, quote, GLP-1 class of drugs appears safe in the MS patient population, unquote. Third, an abstract at the 2025 American Academy of Neurology meeting published in the journal Neurology asked whether people with MS on GLP progress differently over time. They used a large registry and they compared MS patients on GLPs versus not on GLPs, and they followed changes in systems like the brainstem function, coordination, and bowel bladder using standard MS disability scoring. They found lower odds of progression in some systems in the GLP-1 group. Authors stress that this is hypothesis generating, not proof, but it suggests a possible protective signal that needs more studies, randomized trials. So bottom line, human MS data so far say GLP-1 looks generally safe, metabolically beneficial, with no clear signs of MS worsening and early hints that they might slow some aspects of progression. But there are still no large MS-specific randomized trials proving true disease-modifying effects. If you're living with MS and on a GLP-1, this is a bring your neurologist and endocrinologist to the same table conversation. Would love to hear your thoughts.